Welcome back Sunbro. We hope you all in great health and great money. Before we start, please at least subscribe so we can have little money for food and paying bills. Alright, today we are going to talk about 9 surprising causes of sensitive teeth and how to fix them. Do your teeth often feel sensitive or painful? You're not alone. Many everyday habits can contribute to sensitive teeth, but the good news is that understanding these triggers can help you avoid them. Let's explore the top 9 common causes of sensitive teeth and how you can protect your pearly whites. 1. Too much mouthwash. Love that minty fresh breath. Overusing mouthwash can lead to sore, sensitive teeth because some contain acids that make sensitivity worse. Stick to rinsing once or twice a day. If sensitivity persists, ask your dentist about fluoride rinses that can help. 2. Acidic foods. Tomatoes, citrus fruits, and juices are delicious but can erode your enamel and expose sensitive dentin. To enjoy these without the pain, balance them with cheese or milk. 3. Some toothpastes and whiteners. Whitening products and certain toothpastes with peroxide can cause sensitivity. This usually stops when you stop using them. For a safer option, consult your dentist. 4. Receding gums. Receding gums can expose tooth roots, which are very sensitive. If you have periodontal disease causing receding gums, see your dentist for treatment. 5. Brushing too hard. Brushing too hard or using a hard bristled brush can wear down enamel and expose sensitive dentin. Use a soft bristled brush and gentle strokes to protect your teeth. 6. Recent dental procedures. Cleanings, crowns, and restorations can cause temporary sensitivity. If you're concerned, talk to your dentist before and after your visit. 7. Cracked teeth. Biting hard candies or ice can crack your teeth, leading to irritation and sensitivity. Cracks can also harbor bacteria, causing more pain and inflammation. 8. Grinding or clenching your teeth. Grinding or clenching can wear down enamel over time, exposing nerves. Mouthguards, lifestyle changes, and diet adjustments can help protect your teeth. 9. Tooth decay. Cavities expose tooth roots to irritants like hot, cold, and sweets, and even air. Combat decay with good oral hygiene, a healthy diet, and regular dentist visits. You don't have to handle sensitive teeth on your own. Talk to your dentist to pinpoint the cause and strengthen your teeth. Simple changes like using a soft bristled brush, sensitive toothpaste, and fluoride mouth rinse can make a big difference. Thanks for watching, Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.